what is inguinal canal or inguinal region? It is the part of the anterior abdominal wall. What is inguinal region? Part of the anterior abdominal wall below the umbilicus. Below the umbilicus. And what is the speciality of this region? We know the anterior abdominal wall has got some flat muscles. First we get the skin. Okay, just below the skin we get superficial fascia. And in this region, this superficial fascia has got a special peculiarity or speciality. That means the superficial fascia is divided into two parts. One is superficial fatty layer and another is membranous layer. Below that we get a membranous layer. So the superficial fatty layer is the fatty layer of Camper and the membranous layer is the layer of Scarpa. Membranous layer of Scarpa. Then we can get the three flat muscles from anterior to posterior. They are external oblique. Opposite to the direction of the external oblique, we get, actually external oblique is taking origin from above and insertion is below, and the internal oblique is opposite to the fiber, the fibers are just opposite to the fiber of external oblique. So they are taking origin from below, and from above and below the origin is the origin of the Transversus abdominis, which is the next inner muscle. And inside the Transversus abdominis we get the fascia, that is fascia transversalis. And if you go more inside, we get the parietal layer of the peritoneum. One is visceral layer, which is attached to the viscera, and another is this a balloon like the parietal layer. If we puncture that parietal layer, we will enter into the abdominal cavity. Now we can see what is inguinal region. So this is the area below the umbilicus, that is the inguinal region. Okay, and here we can see the three muscles one by one. Okay, that is the external oblique, internal oblique, and transversus abdominis. Then fascia transversalis we can get, and also we can find within this anterior abdominal wall there is one canal. As it is present within the inguinal region, it is called as Inguinal Canal. So here we can see, so first we are getting the external oblique muscle. That external oblique muscle is coming from above, lower 8 ribs, and inserted. Now it comes down and it forms a modification towards, as we go medially, it forms an aponeurosis. And ultimately we got the rectus muscle where we got the rectus sheath. Okay, contributed by both external, internal, transversus abdominis, okay, and fascia transversalis. Here we can find this inguinal ligament. So it is nothing but the part of the external oblique muscle, and that that aponeurosis becomes also gets folded upon itself, and ultimately we can find a folded region, okay, in between the bone and the ligament. And this folded ligament, you can see it forms a fossa-like structure, okay, and this ligament is called lacunar ligament. So, same muscle gets folded like this, okay, and forms the inguinal ligament, and here the folded part extends from the bone up to the ligament. So, that is called lacunar ligament. So, this lacunar ligament has got base, and it looks like a triangle. This is the base and this is the apex, and here we can get the lacunar ligament. Nothing but modification of the external oblique muscle. And another we can get from the inguinal ligament, another part which is get reflected and is continuous up to the linea alba. This is called the reflected part of the inguinal ligament. So, all these are the derivatives of external oblique muscle. Okay. Lacunar, like lacunar ligament you can see, triangular ligament which has got base and the apex, and this is an fascia-like structure which is continued up to the linea alba from the inguinal ligament. Okay. So, in the inguinal ligament, the inguinal region, this is the most important ligament. Why? Actually, this demarcates the abdomen, and this area is the femoral area, femoral region. Okay. So, that is the demarcating point, and there is a space between this ligament and the bone. So, that area is called pelvifemoral space. Pelvi means pelvis, and this is the femoral region. So, this is the area which is called the pelvifemoral space, and we will get the continuation of external iliac, which becomes femoral artery. We know that femoral vein which is continued as external iliac vein. So, we can get all these structures within this. This is the pelvi. So, this is a passage for the femoral vessels. So, this is the pelvifemoral space. Also, we can get that area, that is the femoral ring, okay, most medially. So, this is the important part of the and also we can find this is the lacunar ligament. Okay, this is the anterior part, this is the posterior part. This posterior part is continued, okay, along this bone. Okay, we know this pelvic brim. That means it is continued along this area. So, that ligament is continued along this area up to this eminence, which is called iliopubic eminence. So, that becomes a string-like ligament, which is called the ligament of Poupart. Ligament of Poupart. So, it is nothing but again it is the derivative of lacunar ligament. Actually, the lacunar ligament, the posterior, the base, from the base and from the posterior part of the lacunar ligament, it is continued up to the iliopubic eminence, that is called ligament of Poupart. So, reflected part of the inguinal ligament, we are getting lacunar ligament, we can get the ligament of Poupart, and this ligament, this the inguinal ligament itself is called the Poupart's ligament. Poupart's ligament. So, এগুলো একটু মাথায় রাখতে হবে. So, we have to keep it all these derivatives and names. So, these are the lacunar ligament, apex, and so which have been written here. Okay. So, that is the Poupart's ligament. Okay. Okay. We can find the pectineal part of the inguinal ligament. Okay. That is continued as the ligament of Poupart. So, this is the pelvifemoral space. What I was saying, there is an area between the ligament and the bone. Here we can see the vessels passing through this space. Okay, and most medially we can find this area which is called the femoral ring. Okay, femoral septum, femoral fossa, femoral ring, most medial part of the femoral sheath. We are getting the intermediate compartment, and this is the lateral compartment is for the artery. So, as a whole, this is the femoral sheath, and outside the femoral sheath we are getting the femoral nerve, behind we are getting the iliacus, psoas major, here we can get the pectineus which is missing. So, this is the, and in front we are getting the ligament, that is the inguinal ligament. Okay, we can get the attachment of the inguinal ligament. So, this is the pelvifemoral space. Femoral sheath you know already. So, here within the femoral, inguinal region, we can get a canal which has got two extremities. One is this one and one is this one. So, this is an oblique canal. Oblique canal within the anterior abdominal wall, within the flat muscles of the anterior abdominal wall, which extends from the deep inguinal ring up to the superficial inguinal ring, and it goes parallel and above to the medial part of the inguinal ligament. Okay, just आगे এটা মনে করো. So, there is a canal. So, canal is, when there is a canal, there is some structure will pass. So, within the canal, so that is called spermatic cord in male, and in female that contains that round ligament of the uterus. Uterus নিশ্চয়ই থাকে না, কে একটা uterus বলছিল, round ligament of uterus. That is the round ligament of the uterus. So, we can get two rings. One is, we can get a circular ring, one is triangular ring, but they are not in the same plane. Deep ring is placed at a deeper plane and superficial ring is at a superficial plane. This superficial ring we can expect when we cut open the skin. Okay, when skin is reflected from midline laterally in this region, we can find the external oblique muscle, and within the external oblique muscle we can get this superficial ring, and this ring is within the fascia transversalis. Where is fascia transversalis? External oblique, then internal oblique, transversus abdominis, then we can get the fascia transversalis. Within the fascia transversalis we can get the deep inguinal ring. So, it is 4 centimeter in length, which is present parallel to the medial part of the inguinal ligament, and is a muscular aponeurotic canal through which and it extends from deep inguinal ring to the superficial inguinal ring. What is deep ring? It is an opening, or is a mouth of the opening or the mouth of the fascia transversalis. And what is superficial ring? It is an opening within the external oblique muscle, or is a mouth of the is present within the external oblique muscle. Actually, what is this? This is the canal through which the gonads, along with the gubernaculum, with the traction of the gubernaculum, the gonads actually moves. Okay, in case of male, the whole throughout the length, the testis will come down. When at the 7th month, we can get the testis here within the deep ring. Okay, and from 7 months to 8 months it will travel this area, and at the end of the 9 months it will reach the superficial ring, and ultimately it come down, it will settle within the scrotal sac. So, it was present behind the it is almost at the level of the posterior abdominal wall, it was, and due to the pull of the gubernaculum it is coming in front. Okay. So, when it is coming, so it will cover all the layers of the anterior abdominal wall, like the external oblique, internal oblique, and transversus abdominis and the fascia transversalis. So, external oblique muscle, so it will contribute a layer that is called the external spermatic fascia. Internal oblique and transversus abdominis, it forms another fascia, that is cremasteric muscle and fascia. Okay. Then we are getting the transversus abdominis. So that will form another layer. So that, and internal oblique and transversus abdominis, it will form another layer, that is a cremasteric fascia. Then we are getting the most inner side, that is the fascia transversalis. So the fascia transversalis also contributes another layer to the spermatic cord, that is the internal spermatic fascia. So when it is coming down, it is gaining some layers of the anterior abdominal wall. They are called the external spermatic fascia, then cremasteric fascia, then internal spermatic fascia. They are nothing but external oblique, internal oblique and transversus abdominis as a cremasteric fascia, and most inside, that is the fascia transversalis. Okay, so that is the internal spermatic fascia. So we can get all these structures. Okay, and here we can see one artery is moving. The artery, you can see, it remains medial to the deep ring. This artery is coming from the external iliac artery. External iliac artery has got some branches. And it is one of this inferior epigastric artery is one of the two branches. That is the inferior epigastric artery. You have seen that artery here. Okay. In that body you have seen that inferior epigastric artery. So this inferior epigastric artery, it moves medial to the deep ring, then moves, and it will pierce the fascia transversalis, and it will be a content of the rectus sheath. Posterior, we can find it in the either in front of the posterior wall of the rectus sheath or within the rectus muscle. Okay, and it goes above, and there is an anastomosis from above, that is the superior epigastric artery from above, and from here, that is the inferior epigastric artery, where just little above or at the level of the umbilicus. There is a anastomosis between superior epigastric artery and the inferior epigastric artery. Now this inferior epigastric artery actually is very important guide to find out the deep ring. Okay, so this remains just medial to the deep inguinal ring. When the abdominal content actually comes out through this area and it travels through this area and it can reach to the scrotal sac or in the labia majora, so that is called called the hernia. So it is present within the inguinal region, so it is called the inguinal hernia. So when it passes through this deep ring and travels through the inguinal canal, it comes out, it is called indirect inguinal hernia. Whereas when it is coming medial to this artery, okay, and not through the deep ring, it is coming from behind and it is coming through the anterior abdominal wall directly. So it is called the direct inguinal hernia. So inferior epigastric artery is the guide whether it is a direct hernia or the indirect hernia. So, if the hernial sac remains lateral to this inferior epigastric artery, or in other words, it is passing through the deep inguinal ring, that is indirect inguinal hernia. And when the hernial sac is medial to the inferior epigastric artery, that is called the direct inguinal hernia. Hernia may be complete, incomplete, that means when traverse the whole length it is complete and it reaches the scrotal sac is complete, or the labia majora, that is the complete. And inguinal hernia is more common in male, okay, than the female. Okay. So, we can get, this is the spermatic cord, this is the we can get, this is the spermatic cord, we are getting the transversus abdominis, and we can see the inferior epigastric artery. This red one we can see is here, it is clearly. So, this is the deep inguinal ring and this is the spermatic cord, and it contains the, the contribution is coming from the fascia transversalis, it is the internal spermatic fascia. So, this is the spermatic cord we can get. So, what is the boundary of the inguinal canal? Okay, there is boundary. Anterior boundary means the muscles, that is, here we can see from anterior to posterior. The anteriorly, this is external oblique, this is internal oblique, this is the transversus abdominis, this is the fascia transversalis. So, this picture actually clearly clears your doubt about where is the superficial ring, where is the deep ring. So, this is from the section from anterior to the, suppose there is the section from anterior to posterior, we are getting the external oblique muscle that becomes aponeurotic medially, okay, and within that we are getting this opening. So, this is the superficial ring. Then we are getting the internal oblique muscle and transversus abdominis. These two muscles actually they unites medially, okay. These two muscle, this internal oblique muscle and transversus oblique muscle, these two muscles unites and forms a tendon, okay, forms a tendon medially, that is called the conjoint tendon, okay. These two muscle, this is, suppose this is internal oblique, this is transversus abdominis. So, they joins, they get blended and forms one ligament, that is called conjoint tendon. So, in front of the canal we are getting only the external oblique aponeurosis, and also we are getting the internal oblique muscle, and also we can get the reflected part of the inguinal ligament. But in the posterior part we are getting the transversus abdominis, and this is the posterior wall which is contributed by transversus abdominis and the conjoint tendon, okay. And actually main contribution is by the fascia transversalis. It is said in this way, that is, the anterior wall is contributed mainly by the external oblique aponeurosis, but on the lateral side it is also contributed by the internal oblique, the anterior wall and transversus abdominis. Sorry, that is the internal oblique, and the posterior wall is contributed by this fascia transversalis and also by this transversus abdominis on a lateral part, okay. And these two muscles gets blended and forms the conjoint tendon, and it remains and also it forms a part of the wall of the posterior wall of the inguinal canal, okay. So, but and the posterior wall is actually mainly contributed by the fascia transversalis and medially by the conjoint tendon. Okay. So, this is the anterior wall and posterior wall. Now, what are the contents? What is spermatic cord? Spermatic cord is the cord that is traversing through this inguinal canal. And what are the constituents? First is the main constituent is the very important constituent. All the components are important. That is the vas deferens, which is the vas deferens is coming out from the root of the testis. Okay, and it is traversing through the superficial ring. Then it is going inside the deep ring. Then it is traversing the abdomen and the pelvis, and ultimately it opens within the joins with other duct, and ultimately it will open within the prostatic part of the urethra. Okay, this is the most important point. That is the spermatic cord, which and the spermatic cord, and in case of female, that is the round ligament of the uterus. So, what are the constituents of the spermatic cord? First is vas deferens. Second, the voluminous bulk form, that is the testicular vein, that is called Pampiniform plexus. You can see structure, that is the testicular veins. So, actually there are several veins are coming out from the testis, and ultimately they join with each other, and at the superficial ring we will get, at the level of the superficial ring we will get the 4 veins, and at the superficial ring they will join, ultimately we will get 2 veins which will move through the inguinal canal, and within the deep ring they will join, these 2 veins will join, and ultimately at the when it will pass through the deep ring, we will get the single vein, that is the testicular vein. On the right side, this right testicular vein drains into the inferior vena cava, and on the left side it drains into the left renal vein. Left testicular vein is the length of the left testicular vein is more than the right testicular vein. Okay, and it comes out and comes up, and it drains at a right angle to the left renal vein. Okay, and it has to pass behind the, you know that is the sigmoid colon, which is filled with the fecal matter. So, there is a tendency of development of, that the vein becomes elongated, tortuous, which is called the varicosity of the vein. So, left testicular vein is prone to develop the varicosity. Varicose vein means long, the vein becomes long, tortuous, long, dilated and tortuosity. Long, it will become long, dilated and tortuous. So, that is called varicosity. That is the varicose vein is more common in the left side. Forget it. The next constituent is the sympathetic plexus. It is coming from the abdomen. We know there is sympathetic chain, so it will go the sympathetic plexus for the testis. And also we will get another contribution, that is one of the important constituent, that is the testicular artery, or in case of female, that we will not get it because there is an anastomosis between the ovarian artery and the uterine artery. We will know later on. So, in case of male, only we can get the testicular artery, which will move through this deep ring and it will come out through the superficial ring and it will enter into the scrotal sac and ultimately it will supply the testis. Okay. And we can get other components, that is we are getting a lymphatic drainage from the testis. It will also pass through this area. And also we can sometimes get some abnormal constituents within the spermatic cord. What are those? Just guess. Abnormal constituents. বললে এক্ষুনি স্যার আমি মাথায় ছিল এলো না, আমি একটু আগেই বলেছি there is a journey of the testis, undescended testis, it is very common, not very uncommon at least. After the birth, the pediatrician actually checks all the parameters. One of the important parameters is checking whether if there is any testis or undescended testis at the inguinal region. Okay, that's because that undescended testis we have to surgically bring down and we have to put it within the scrotal sac, otherwise there will be some complication like infertility, like seminoma, the cancer of the testis, it will develop. Okay, so undescended testis. Another abnormal constituent, over descended ovary. Ovary তো ওখানে যাওয়ার কথা না, over descended ovary. Next, spleen we can get. Spleen, we can get spleen. There is one organ you can see in the body, in the abdomen, there is a spleen. It is part of the reticuloendothelial system, spleen. Others, suprarenal glands also we can get. So this is the spermatic cord and the inguinal canal, inguinal region. Okay.